Welcome back to another episode with Bantering with ByrdAdatto. We've done almost a dozen videos and webinars in the last few months on safety needs to protect your business and practice from COVID in your facility. But what happens when COVID gets into your facility? To address these issues, we have a mini series we've put together for y'all, and we're calling it COVID Questions from Our Clients. So today's question is, Michael?
Today's question, Brad, is if I'm a healthcare provider and I follow the CDC guidelines for the proper wearing of PPE, do I need to quarantine if we were exposed to a patient with COVID-19?
Generally, the answer is no if you're wearing PPE. The only time the answer would be you may have to consider a quarantine or self-monitoring is when you were treating that patient. If the patient removed any cloth covering and you were in the room with them for for over 15 minutes, and you were again around the mouth or nose, and you did not have goggles on or eye protection, then you would need to go through the CDC quarantine guidelines at that point, because the CDC is worried that if that person's mouth is uncovered. So again, if you have PPE on and it's just a surgical mask and not goggles, and that patient removes a cloth mask, then you would have to quarantine. But if you were wearing goggles and a mask and the patient removed it and you're with them over 15 minutes, you would not need a quarantine. And so, as you can see, there's a lot to unpack when it comes to COVID. There's so many different laws and regulations, but we're trying to answer each question as they come in. Hopefully, throughout this mini series, we'll be answering a lot of your questions. But of course, if you have any other questions, just reach out to us. So, thanks again for joining us today.